Hello everyone. Today we'll be discussing about actinic keratosis. Alright, so this is the second last topic that we'll be taking in this rapid revision series. Okay, so first of all, why does this happen? Okay, this is because it happens at the areas of sun exposed areas. Okay, and one word, right, that is important for this topic, that is the sandpaper like skin. Alright, the sandpaper like skin is the classical word for this chapter. Okay, we'll be discussing more about this. It is a very short one, but yes, we should know just 2-3 points about it and we are all good to go. Let us begin. Actinic keratosis is a cutaneous lesion which typically occurs from what? Excessive sun exposure, right? So nothing can damage the skin as much as the sun, right? Time and again we have proven this. Yes, so that is this, for this condition it also holds true. From excessive sun exposure. Okay, that is one thing. Okay, actinic keratosis presents as macules, papules, and that they have potential to become what? That is the next question, right? Potential to become what? They could become malignant, right? Okay, fine. They could become malignant. All right. What are the risk factors? Anybody could guess. If they are thinking like too much about the risk factors, I don't think so. They should think, because chronic sun exposure is the risk factor, right? The one which we just discussed about it. So chronic skin exposure, sun exposure is one of the reason. Okay, and having fair skin type is another risk factor for having actinic keratosis. Alright, that is one of the reason. Okay, and being immunocompromised also predisposes to this condition. Okay, all right, but the thing is that, okay, fine, these lesions are there, okay, but they occur on the face. Yes, they could also happen on the scalp, dorsal aspect of the hand, and lesions, they are usually dry and pale in color. All right, usually that would be the presentation, but they could also be hyperpigmented patches. Okay, as we can see here. Okay, over here you can see on the dorsal aspect of the palm, right? Over here you see, right here we see, like, this is the hyperpigmented one. This is not so hyperpigmented, yes, but it is not hyperpigmented. It has an erythematous base. Okay, that is one thing we need to be vigilant about. Okay, but and one more thing, this, the patients, they usually they have these macules and papules, right? But they usually complain that, okay, fine, there is for certain duration of time there is, and after some time the lesions, they go away. All right, they returns a few months and there is spontaneous regression of these lesions. Okay, only 10% of actinic keratosis progress to what? To progress to squamous cell carcinoma. Okay, squamous cell carcinoma. Okay, actinic keratosis is diagnosed clinically with visual inspection, palpation of the lesions. Okay, or what do we do, right? Or what can we do is, we can, if there is suspicion of malignancy, so what we would do is, we would do a punch biopsy, right? Okay, that is one thing that we have to do. Okay, on physical exam, the skin lesions are typically few millimeters in diameter, scaly, and have what? This is the first thing that I told you about this chapter, and they have sandpaper like skin. Okay, sandpaper like skin. Okay, sandpaper like texture they would have. Okay, and yes, Over time, the actinic keratosis may result progression of to squamous cell carcinoma as well as scarring could occur. Treatment, definitely it has a very broad range of treatment, right? But yes, it would depend on the presentation of the patient first. Second, how much has it been progressed? That is another thing that would be taken into consideration when providing the treatment to the patient. What can we do? 5 fluorouracil, yes, that is one thing we can do. Imiquimod and diclofenac we can be given, right? Surgical options, we have this cryosurgery, right? We were using this for which all presentations we did in this series as well, right? What we did was for the wart, right? Warts we were using this, okay, and we can use the cryosurgery, and we can also use the electrocautery, right? Okay, and we can do curettage, excision, and derma aberration could be done as well, right? So we can just take off the layer of the skin of that particular area, and we can help promote the regrowth of the skin over there. All right, so yeah, that is all about actinic keratosis. Yes, a very short topic. Yes, nothing much in it, so just remember sandpaper like skin, and that's all I think, and do make sure like if you can identify the lesions in the exam. That is one thing we can be very careful about. All right, thank you so much for listening.